Hello, everybody, and thank you for joining us with Xtract, more on the science side of what we do and how we do it. Today, we are going to go into a little bit more detail, or kind of an extenuation of Ms. Tina Seitz last week, who talked about allergic reactions, when they happen, what causes them, and then, of course, how our process helps with allergic reactions. So today, we're going to talk about completing a health assessment and what are things that you should look out for, and how the immune system works and why it's so important that we go over these things. So I'm going to share with you my screen. See if I can get this working. Okay, does everybody see that? Okay, so this is maximize your efforts working effectively with the immune system. We know that in our process, we act synergistically with cells, right? We work with the cells. So we, unlike any other removal system, which is prohibiting or causing damage to the immune system, we activate it. We want it to work more effectively than it has in the past or on a normal basis. So it's really important for a person's immune system to be operating at its most. So we're going to discuss a little bit about immune systems. And when we're talking with people, some of the things that we're going to, that's weird. Oh, there it goes. is the immune system. So our immune system is in order to help us fight bacteria and fight off unwanted disease and foreign objects inside the body, right? It's a complex network of cells and proteins, and it prevents disease and infection. It also keeps a database of every microbe or germ that it has been exposed to in the past, and it enables it to be able to recognize it faster and destroy the microbe, the germs, even on a faster note when it is exposed to the body again in the future. And then, of course, abnormalities, disorders or diseases can lead to allergic reactions, immunodeficiencies, and autoimmune disorders. So if your immune system isn't operating healthy, then these are the things that can happen. And we're going to talk, of course, the immune system has so many different parts. It's very complex, but we're going to talk about just a few that are specifically related with our tattoo removal system. So first is that we're going to talk about white blood, not necessarily in this order, but white blood cells, antibodies, lymphatic system, spleen, bone marrow, and thymus. So first, the white blood cells. They are created mostly in the bone marrow. They're part of the lymphatic system, and there's so many different types of these white blood cells. There's B cells, T cells, natural killer cells, macrophages, and there's so many more that you can go into really a lot of depth about white blood cells. And then there's also the antibodies, which are the ones that recognize the antigens on the surface of the germ, right? Or the chemicals that the germ produces with the toxins or foreign objects. So this could be in relation to ink that is in the body. It's a toxin, it's a foreign object, so that's what it recognizes. And then, of course, they mark these antigens for destruction. It's like a memory cell. It is able to remember exactly when the body is exposed to it again, and it's able to come in quickly and to attack it and to be able to destroy it. Then there's the lymphatic system. The lymphatic system is kind of the sewage system for the body. It is a very detailed, intricate network of delicate tubes really all over the body. And this system is what enables the macrophages and lymph and everything to be able to carry away these toxins and foreign objects. That also helps remove the fluids that leak out of our blood vessels. It also reacts to and traps anything that produces diseases or causes disorders. This is bacteria, cancer cells, and cell products that can cause this. It is comprised of three main things, which is the lymph nodes, the lymph vessels, and of course, white blood cells. The lymph nodes produce cells and antibodies which trap the microbes. The vessels is what carries it back to the lymph nodes to be able to be destroyed there. And then, of course, the white blood cells which fight off and destroy it. Then we have the spleen, which is a person can live without their spleen, but if in doing so, what happens is it puts a little bit more of a strain on the other organs because its job is to filter the blood, and it destroys and cleans out old and damaged red blood cells. It detects in pathogens and cancer cells, and then it also helps make antibodies and white blood cells in order to fight disease. The bone marrow is what is in charge of the production of our red blood cells and, of course, white blood cells to fight infection. And then, of course, in order to blood clot. And during this procedure, there is some blood involved, so you want to make sure that the person is able to, and of course with proper needling, is able to clot, no problem. And then thymus is right above your bone sternum, breast sternum. It helps to, it's kind of like a little storage facility that stores your lymphatics or your T lymphocytes in order to have a backup supply of white blood cells. And then onto skin, of course, our skin secretes an oil, right? It has its natural bacteria killing properties within our skin. So that's really important to have that moisture as well and to be able to reduce this risk of infection because this oil, again, it kills bacteria because it has these enzymes that actually eat away at it. So when a person has an overactive immune system, this can easily cause an allergic reaction to something. Some people are more prone to, it's actually called an allergic disease for some. They call it that, and it's just because they're much more reactive to foreign things. These people are reactive a lot of times to many, many things that they have reactions to. Then we have autoimmune diseases and disorders. This is the body's, its natural response. It basically attacks its own body organs that are helping to be able to normal function. They range from, some of them are really common, some of them are very rare. So when you're talking about ones that are common, you'll recognize it pretty much immediately when people talk about their thyroid disease, diabetes, arthritis, eczema, asthma. All of these are autoimmune diseases and disorders. So if you're not aware of what somebody has, you definitely want to check into it and see how it affects the body and what it does to cause a response. Immunodeficiency. These can be, this is where your immune system does not operate well enough. So first you have a normal, healthy immune system, and then you have one that's overreactive, and then this one's underreactive. So a lot of times this is inherited. This also can be a result of a medical treatment. For example, if a person is on a lot of steroids, or if they have gone through chemotherapy, this automatically causes their immune system to not be able to function properly. We also have immunodeficiency because of diseases. This could be from HIV, AIDS, hepatitis, cancer, from different types of cancer can actually cause immune dysfunction. Immunosuppression treatment, that's anybody who has had an organ transplant or just something that they are on a treatment to suppress the body's natural immune response. The health disorders and diseases, sorry, that's supposed to come up all at once. So these are some of the different things that we want to look out for when talking to a client, right? Because we try to stimulate and work with the immune system, if the immune system is not working properly, then we are not going to be able to have the best healing results and the best ink release. So some of the things that we want to look out for is if the person is on something that suppresses the immune system. And that could be an organ transplant for one. Of course, this page is not everything, and it's not saying that these are 100%, does not mean you can't perform this procedure. It's things that you need to look over. It's things that they need to discuss. You need to discuss with them. Some of them will absolutely be contraindications. Some of them are things that they need to discuss with their doctor and be able to get doctor clearance on based on their immune system. If they have been in recently through surgery or sick, right? This alone, the body has already gone through a lot, and its immune system is already stressed trying to recuperate and be able to build back to a healthy state. So we wouldn't want to do somebody immediately if they had recently had this. Wait till they are well and doing good. If they have had any type of lymphatic damage, this could be removal of lymph nodes, radiotherapy, lymphedema. All of this is because maybe some type of lymphatic damage, and so this obviously puts more stress on the immune system. Different types of cancers are an alert. For example, I think it's called chronic lymphocytic leukemia. And this cancer is, my dad actually has this, it is cancer of the body in the bone marrow produces bad white blood cells. These white blood cells, before they are even able to mature to be of a help to the body, start replicating. Well, of course, what does this do? The body, now they're sent out throughout the body. They can't do their job, which they're designed to do, and now they collect up in the lymphatic system. So this person's immune system is majorly compromised. Then there is, of course, heart disease and stroke. This could cause different healing problems if they don't have good circulation. Different types of communicable diseases, HIV, AIDS, hepatitis, tuberculosis, anything that suppresses or causes a person to not be able to have a healthy immune system would be somebody you wouldn't want to undertake. Autoimmune disorders, of course, there's so many of them. It doesn't mean that you can't perform procedures on people with autoimmune diseases and disorders. It just means that you want to look into it, know what it does to the body, and know if this person is going to be a good candidate or not. Diabetics. Diabetics are known for not being able to heal as fast and as quickly, so that would be of a concern, especially if it was on the lower legs or limbs. It would cause more of a problem for healing. If a person is prone to keloid scarring, this person is, it's an overdevelopment of scar tissue. That's not going to be a good idea either. It is a disorder. Then there's different types of pharmaceuticals. Again, we talked about steroids. Any type of NSAIDs, so that is your ibuprofen, your acetaminophen, your antihistamines or Benadryl, all of these suppress the immune system. We want inflammation during this process. I know that in the Western world, in the many parts of the world, the answer is to suppress the immune system, right? They don't, oh, you don't want inflammation. No, we want inflammation. The inflammation is the body's natural immune response. It's the way the body enables it to clean out the infection and carry away diseases and disorders, which includes the toxins and ink that we're trying to remove within this ink allergy. There's also Botox. Of course, you're not going to be able to get people to quit doing Botox altogether, but you want to make sure that they're towards the end of their Botox instead of where they've just received it, or if they can even hold off even better, just because this slows down the circulation, this slows down the body's and inhibits the body's ability to have proper blood flow. There's also Accutane. Accutane does a number of things to the body. One of the things that it dries it out, right? Remember we talked about the skin having this oil that has antibacterial properties. Well, now we're taking away that. We're taking away that oil from the skin. It also causes problems with skin disorder, the ability to create healthy scar tissue formation. So that's also a concern. And then there was one earlier I was just thinking of that I forgot to put on here. If I think of it later, I'll come up with it maybe at the end after Leah talks. And then there's, of course, smoking. Smoking deprives the skin of oxygen, right? So we want to be careful of that. Person can either cut back, or if they can stop altogether, even better, to enable the best healing. Pregnant and nursing, of course, this is absolutely all the time. And no, a pregnant person already is more heightened, and so a person will have sometimes a reaction to their tattoo after they have become pregnant, but we do want to wait until after they have delivered the baby to be able to perform this procedure. Until then, we do recommend the product Heal, as that will help the body to be able to easily manage this allergic reaction. So really important, we want to perform a thorough consultation. Don't just rely on the paperwork that you give them and making sure that they have everything on there. Also go with them through it and verbally talk to them, asking them questions to see if maybe they missed or forgot or left anything out. The next thing we do is we want to educate ourselves. Educate ourselves on the diseases or the disorders that they may have. It is always a good thing, if you're not familiar with it, look it up. Sometimes if you have a pre-questionnaire before they come in for their appointment, this enables you to be able to look up information about that disease or disorder that's on their paperwork. And then when you talk to them, you are more educated and you sound more reliable. And then, of course, if need, you want to perform a patch test. This is something that helps. Leah is going to talk about patch testing in regards to, I believe, inks and knowing what to look out for on that. All kinds of stuff Leah's going to talk about regarding patch tests. And then, of course, when in doubt, get a doctor's clearance. There's a lot of things that you will want to get a doctor's clearance for. A doctor's note, approval, saying that they can go through with this procedure, but when in doubt, always get one of those. So, Leah, I'm going to hand it over to you so you can go into detail about your, let me see if I can stop sharing my screen and hand it over to you.
Excuse me if I'm looking from side to side, guys. I am working on 2 screens here. Let me just share mine now. Let's have a look. Can you see that one? You can, perfect. There we go. So, hi guys, I'm going to be covering patch testing today. So as you can see, we're going to cover a few different topics on patch tests themselves. So we're going to talk about what is a patch test, why to complete a patch test, when to complete a patch test, signs of a positive patch test result, Xtract patch test protocol, what is a spot test, why complete a spot test, and Xtract spot test results. So we're going to show you some actual results of a spot test on an allergic reaction granuloma case that I'm currently working on. So there we go. What is a patch test? So a patch test is a method used to determine whether a specific substance causes an allergic reaction on a client's skin. It's used for both cosmetic and medical treatments to test products which are to be used in an upcoming treatment. A topical test is a form of patch test used where all products used during the planned treatment will be applied topically. So this is like your waxing, your tinting, brow henna, lash tinting, even hair dye. They're all topical patch tests. If you've ever had one of these before, it's literally just a little dab of the product on the skin and you leave it for 24 hours. Whereas a scratch test is a form of patch test used where the technician must break the skin before applying the substance to be tested. So if we think about permanent makeup or removal or anything like that, our treatment breaks the surface of the skin, so our products aren't just sitting on top of the surface of the skin, they are actually being implanted into the skin. So we need to do a patch test which will realistically represent the treatment that we're going to be performing. So why to complete a patch test? For one, you need to protect yourself and your client. There is currently no law to enforce patch testing. However, most insurance companies stipulate that patch tests are required when advised by the manufacturer. This is something for the UK. I'm not sure, it works obviously differently in different countries, but in the UK, insurance does stipulate that you do have to offer patch tests. The client doesn't have to take you up on it, but you do need to offer a patch test, even whether that's brows, liner, or any treatment that you're doing. you need to offer a patch test of those products. So if the client agrees to have the patch test done, which is great, they have to sign a consent form to agree that they've had it. And if they choose to waive that option, then they obviously have to sign a patch test waiver. A patch test helps us identify which, if any, products of that your client is allergic to. So when patch testing products, and you'll see in a little video that I've put together as well, you do want to leave a reasonable amount of space between your products as well, because you need to be able to tell which products the client is actually allergic to if one of them does flare up. Most allergic reactions begin immediately after exposure. Patch testing is a quick and simple way to avoid exposing the client to a more invasive or larger load of an allergen. So obviously, if we're completing a little patch test, they're only going to be exposed to a very, very minor amount. Whereas if we expose them to a full treatment straight away and they were allergic to something, obviously there's a risk of being a much more serious reaction there. So when to complete a patch test? This does vary from insurance company to insurance company. For some permanent makeup insurance companies, they actually do up to 2 to 3 hour patch tests. So we recommend, we supply pigments as well and stuff like that, but we always recommend at least 24 hours. In the UK, even for Xtract, I do recommend 24 hours, although it's highly, 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 highly unlikely that anyone's going to have an allergic reaction to it. As I say, we have to offer that patch test at least. So for insurance purposes, there is actually a maximum timeline that a patch test lasts. So if you do a patch test on one date, for example, you've got 12 months from that date until that patch test expires. So if your client doesn't have the treatment done within that 12-month time frame, then they're going to need to undertake a new patch test. A patch test should be completed if anyone has any known allergies or is worried about any of the ingredients. Sometimes some people can think that they might be a little bit sensitive to something, maybe an essential oil or something like that. They might not have actually had an allergic reaction, but if there's any worry or any concern at all, always just do a patch test first. And if anyone has ever suffered from a past dermal reaction, so by dermal reaction, we mean something that's affected the surface of the skin and how the skin appears. Obviously, even more serious reactions, you can have your anaphylactic reactions as well. So if anyone does ever suffer from any reactions, basically, you want to be making sure that you are patch testing them for your products. So signs of a positive patch test result. When we say the word positive, a positive patch test result, it doesn't mean it's a positive thing, it's great. It's actually the opposite to that. So a positive patch test result means that you're showing signs of an allergic reaction, basically. So a few of those signs would be uncomfortable burning, itching or stinging sensation for the client, fluids in the area such as pus or blood, heat from the area, which can also represent as an infection, but it can also obviously be from allergic reaction, and red, scaly or blistered skin. So they're the kind of 4 things that you do look for when looking for an allergic reaction or a positive patch test. So if you or your client suspects a positive patch test result, the client should wash the area of the product as soon as possible using warm soapy water, pat dry and contact a medical professional. You need to get them to get in touch with a pharmacist or a doctor or their dermatologist. Do not advise to take any medication. We're not medics. If you're a doctor, then maybe you could, but we're not medics. We're not medically trained. We're not medically insured. We cannot be liable for telling someone to just take an antihistamine and you'll be fine, and then going into anaphylactic shock or anything like that. We would then be liable for any trauma that happens to that client. So please never advise your client to take medication, and just advise them to keep in touch and seek medical help. So I've put together a little video for the Xtract patch test protocol. So I'm just going to go through this with you. Let me get this to play. Perfect. Okie doke. So the first thing that we're going to be doing is thoroughly cleaning the skin in the area that needs to be patch tested. So we're using an alcohol wipe to do that and making sure the area is completely clean. And you want to allow the area to dry as well before applying your products. So the first one that we're going to be performing is LMX. So we use this in the UK because there's no adrenaline in it. We're not allowed to use anything with adrenaline, any anaesthetic with adrenaline in it in the UK anyway. But it doesn't blanch the skin. It doesn't draw any blood away from the area because we don't want to be using a vasoconstrictor. So we use this, whichever anaesthetic you are using. Sometimes I'll use EMLA as a pre-numb and LMX as a numb during if they need it. So I'll patch test both the products. What I like to do when I'm organising my patch test, you can see on the video there, is that I use a little part of the plaster from when it's been separated and I just stick it back onto the end. It's just easier for application. So the second product that we're preparing is our activation serum. So this is the product that we use during the treatment for needling and the initial soak. The active ingredients in that one are the 1,3-beta-glucan that triggers that immune response. We've got the bentonite clay and Himalayan saline as well. I do like to make a point we are only 10% or less on the saline, guys. The third product that we're preparing is our Xtract withdrawal mask. So that is the next product used basically as a mask, and we put that over the needled area and that kind of draws that ink up to the surface. It's got bentonite clay, activated charcoal and essential oil of lavender in there. I do like to prepare all of my products first before breaking the surface of the skin because that way it avoids any cross-contamination. And then the final product that we're going to be preparing is the patented repair serum. So this is, we do apply this before the client leaves, but it is also used as the aftercare product. So there's loads of ingredients in this that are really, really good for the skin and really good for healing. Your main active ingredients are the copper and zinc peptides, the AC11 and aloe. The last one, is that going on? No, that's not going on there yet. Let me move that forward. Perfect. So what we're going to be doing now is we're going to be creating small little scratches on the surface of the skin. So we use something that's called a lancet. So they're used for kind of your pinprick blood tests. Instead of actually pricking the skin, and what we want to do is create very, very small micro scratches, making sure we are still breaking the surface of the skin. And then you can see I pick up the little piece of the plaster that I applied before to make it easier, and we just cover the scratch with the product. All of these products will be used on broken skin. So we want to patch test all of those products on broken skin. And then the last one that we're applying is our Tegaderm dressing. So for Xtract, we utilize a moist wound care environment. So it's essential that we patch test the dressing that will be used during the aftercare to make sure that the client isn't allergic to any of the adhesive. So I have used plasters. I always purchase latex-free plasters to minimize any risk of allergy there. And if someone does know that they're allergic to adhesives in general, then this procedure, the patch test and Xtract itself can be done, but we do need to try and still keep it as much of an airtight environment as possible. So we tend to use cling film as an alternative covering in there. So we've just covered patch tests. So that's your topical patch test, as we discussed before, and your scratch test, which is what we should be using for permanent makeup. We should be using for removal as well. There is a third form of patch test, which is called a spot test. So what is a spot test? A spot test is performed after a patch test, but before a full treatment to test the products and technique on a small specific spot on the area of skin to be treated. Advised especially for removal procedures on allergic reactions. We really want to test how that area reacts to the removal process. It may be recommended by the client's doctor or dermatologist for them to analyse the results before recommending a full treatment. So why perform a spot test? It enables the clients to have an experience of aftercare prior to the treatment. So again, we're utilising that moist wound care environment. It's especially important when we are working on allergic reactions, because we really need to make sure that we seal that aftercare product in. It allows you to analyse the skin and the tissue in depth and understand how it will take to the treatment, understand how it's going to react to the treatment. It allows you to identify which adjustments you may need to make to your needling or aftercare for a particular client or area of skin. And it allows the healthcare professionals to analyse the treatment and advise. So on very, very severe allergic reaction cases, I would actually recommend, I mean, especially with the one that I'm working with in the UK, her dermatologist hasn't fully, what word am I looking for? Hasn't kind of let her go from the treatment list. So she keeps in touch. She can have an appointment. I think it's every 3 to 6 months. He just wants to keep a review on it, which I completely agree with. Talking about helping you, letting you adjust your needling technique. Erika, you worked with me when you were over, didn't you, on that allergic reaction case as well? In some areas, we did have to slightly adjust our needling technique, didn't we, because of the 3D, how 3D the granulomas were and how much they were stretching the skin. So, spot test example. So this client is a client that we're working on in the UK at the moment. Unfortunately, because of events and obviously because of lockdown due to the coronavirus, she's not been able to have a recent treatment. So she has got a little bit of aggravation in there because she's almost battling against it. We're coming up to the last few treatments. But she basically had her eyebrows done years ago. She's had them done numerous times. From multiple technicians using a complete variety of products and all over a number of years. So we have got so much going on there, so many different pigment brands, so many different techniques, and so many different products used, obviously. So when this client initially started reacting, she started off with small little red dots, which is often how your granulomas start. Over a couple of months, they did form into these full bone granulomas in certain areas that they were up to 4 millimeters in height. Often you'll find with granulomas, they do start ending up almost like cracking and peeling because the skin is so tight because it's so stretched. Her only other option was steroid injection, which can only be done for a limited amount of time. There's a risk of very serious scarring with that. Or surgical extraction, which was the route that her dermatologist was kind of looking towards. After seeing the results from our first spot test that we did, again, we did the spot test to check the area, and they were absolutely blown away. They actually said, there's nothing better that we can do for you, just carry on with the treatment. So this is an example of the granuloma removal. And one thing I do like to tell everyone about before they see these images is that granulomas are a mass accumulation of cells. So they do want to bleed quite easily. The redness that you see is going to go down really quickly. Although you see it very red in the photo, after our withdrawal mask and the soothing properties of that, the redness does reduce on removals. But I'm just going to show you the picture here. You can see where we've spot tested those areas, sorry. So that was on the left, it was obviously when she came to me. And I think it was, at the next photo, you'll be able to see a really deep granuloma in there. So we marked out the areas that we wanted to spot test, and we wanted to work on different types of skin as well and different thickness of granuloma. We actually ended up, if you can see my mouse on the screen, adding an additional little area here, and that was simply because she used to say that was where she could really feel it the most. When I was talking to her throughout the treatment, she was like, there's one spot and it really gets me. So that's why we ended up testing that area as well. So you can see these photos are, I think they were 4 weeks healed, and you can see the massive difference in the skin. If you look at the needling photo, although obviously you've got that granuloma there and the tissue is very damaged because of that granuloma, if you look at the surrounding area and you look at the areas that we've actually needled, you can see with our needling technique, it is causing minimal trauma to the skin. If you zoom in, as we can here, again, you can see that texture from the granuloma, but the surrounding areas, anywhere that we've needled, the skin is intact. We've done minimal trauma. So yeah, you can obviously you can see the difference. That is after one spot test, so one treatment on those areas, just for us to obviously test how it was going to react to the products and the protocol, which was amazing. It's just a shame, obviously, we're in lockdown at the moment and we can't carry on with the treatment how we would have liked to. So that's that on there. So one thing I just do want to, where are we? Let me stop sharing. Do want to make a point of is with your patch test, you have to complete all the paperwork. Or paperwork is so important. You have to, no matter what treatment that you're doing, you have to document that treatment. For different countries, it varies. But in the UK, clients have got a minimum of 3 years to put a claim in from a treatment. So you could have completely forgotten you did that client. You could have moved in that time, but they have still got 3 years to put a claim in from there. So you need to document everything, take photos. We're really thorough with our protocol. We get photos, before photos, after needling, after the mask, with the serum. We get 48-hour reviews. We're really strict with that because you have to protect yourself no matter what treatment that you're doing. So paperwork is really important. If, regardless of whether your client wants the patch test or doesn't want the patch test, they have to sign the relevant paperwork. We have a patch test consent form and we have a patch test waiver form. And the last thing that I do want to make a point of is no matter how much I stress the importance of patch testing, it does not guarantee that there will never be a reaction there. So with our products, obviously, with Xtract, we're not leaving anything in the skin. So there's not going to be that delayed reaction years and years later. Nothing that we work with is being left in the skin, but we have to think about permanent makeup. Those products are going to be left in there for a very long time, if not forever. And there are cases, as with the client that you've just seen of mine, where you can get those delayed reactions years and years later. But you're not in control of that. And as long as you've done the relevant paperwork and you've done everything professionally and ticked all the boxes, then you'll be covered. It's not, like I said before, you want to protect both yourself and the client. So yeah, that's it from me on patch testing. Let's see.
I do remember.
Oh, sorry, go on.
One of the, I know that on my thing, I did forget a few things. One thing was on the pharmaceuticals is that I remembered what I left off was antibiotics, right? Antibiotics go after and kill all bacteria, good and bad, okay? They kill everything in the body. So when that happens, we have suppressed the body's natural immune system. We've suppressed the ability to fight off disease because we've killed everything. So that's another thing that the person needs to be off of prior to doing the procedure. So that was the one thing I forgot. I know I forgot a few things, but.
No, definitely. They really do deplete your immune system, don't they? Your antibiotics.
Yes.
Absolutely.
So that's really important. And then some of the things I know that it's been asked before, well, what if a person needs, they can't, if we don't recommend them taking, we don't want them taking things to suppress their immune system, right? Because we want those macrophages to be optimal. We want them to be at the, performing the best in order to, and for the 1,3-beta-glucan to go in and start attracting the toxins and the ink and foreign matter. We want to be able to trap all that with the ingredients and pull it out. I forgot where I was going with that. What did I say?
I'm not sure, but it did just remind me of one thing that I wanted to stem off there. With the extract, obviously you want it to be the sole focus of the immune system, so that you don't want to create that immune response and then just put it to waste by go and have your Botox done or going and having a tattoo done or something else like that. We want it to be the sole focus, and that is the way that you will get the best results, by allowing all of those macrophage cells from all of those traveling macrophage cells from all over the body to focus on that one area. Yes.
Very important. So do you have anything else you want to add? Do we have any questions?
I can never find this question through screen. Let me have a look.
If a child had tuberculosis, a client had tuberculosis as a child, are they a good candidate for removal? It honestly would depend. I would ask a lot of questions, find out a lot of information, and have doctor's clearance.
Agreed. I do the same thing. Oh, yeah, 100%. Is that the only one?
I think that's it. Okay, everybody. Well,
at the very end.
Well, I think, do we know our topic
for next time, Leah? I know not for next week. I'm putting together, it's not just myself, I think you're going to do some as well, but Julia, we're going to actually be doing some case studies, so you can actually see the process basically of some of our actual clients. Sometimes it can be quite a lot to absorb the science without the visual of how it actually works and what is the process. So then we're going to put together some of those. But I'm not 100% on what the specific topic is for next week, as I know I'm on next week, unfortunately.
Okay. Well, we will definitely keep everybody updated on what we will be talking about next, whether it will be, I guess it will be next week for sure. So yeah. Stay tuned for that. But thank you so much for joining us today. If you have any questions, please don't hesitate to reach out to us, so that way we can get your questions answered. And I'm sure there's some things I missed, so please feel free to text, email. You can chat through all different types of platforms. So however you want to contact us, do so, and we will get back with you. Thank you so much, everybody. Have a great day.
Take care, everybody. Bye.
Stay safe.